Hello, everyone. How are you all doing? Welcome to TALRadio. This is me, Saankhya, hosting through the interview today. At TALRadio, we bring you the interviews which light up the passion for making a positive impact on the world. So we are very choosy about what we bring to you. So far, we have seen organizations working for a specific cause, but this one today that we're going to talk about is exceptional because they build relationships with the world's most vulnerable people and heal communities both physically and spiritually. So I'm talking about Medical Ambassadors International, MAI. So, MAI is a nonprofit organization that focuses on equipping and training healthcare professionals and community leaders to provide healthcare, promote health education, and improve overall health and well being in underprivileged communities around the world. Sounds like a huge responsibility, isn't it? Now, how do they deal with it and what keeps them driving? We will know everything about them today. So we have the president of MAI itself to guide us through the organization today. He is Dr. Ravi Jayakaran, and he has well over 3 decades of experience leading strategic and poverty reduction strategies and developmental programs and all that. Now, he is also someone who believes in holistic development, and that's exactly what got me excited and feeling privileged to be hosting him today. So, without a further ado, let me welcome Dr. Ravi Jayakaran on the show. We
for
are
having me.
so happy that you're here today and giving us the time to host you.
My privilege to be here.
So, would like you to brief us a little bit about yourself and also the Medical Ambassadors International. And could you also please tell us how it came into existence?
Okay. So I'm Ravi Jayakaran, and I'm the fifth president of Medical Ambassadors. I'm based here in California, and Medical Ambassadors is an organization that works on health-focused community development. It's essentially holistic development, integrated community development. And we work in 75 countries around the world, impacting a population of almost 3 million people through the work that we do in 2,674 communities. So a community is essentially like a village between 800 to 1,200 population. So Medical Ambassadors, as I mentioned, focuses on grassroots level participatory training and empowering strategies. So we work at the grassroots level with communities in a diadectic mode. Diadectic means we don't come there with instructions on what needs to be done. We work with the community, find out what their struggles are, enable them to diagnose their situation and look at the resources that they have so that it can move forward. In doing this, what happens is the development process that constitutes, lives being transformed, lives being healed, and a community being changed becomes sustainable. So that's what we do. We use a program called Community Health Education, or CHE, and that's the one that's the grassroots process. So it's based on participatory approaches way back in the 30s, about 30, 40 years ago. This was introduced even in India, and they called it PRA, Participatory Rural Appraisal and Participatory Learning and Action. So it essentially looks at communities and sees what they do for their survival and help them to better that, to increase its capacity and reduce its vulnerability. That's a whole process.
Wonderful. So I would like to know what drives you to run MAI?
Well, I believe it's my personal faith that drives me, because I chose to move from the corporate sector and the international development programs to take on a task that really and truly benefits the poor and the marginalized. And so this is what we do. My wife Vimla and I live here in California. We moved from India to various places, first Cambodia, then China, back to Cambodia, and then we moved to the US. And as I head this organization, I see the opportunities to share with them the things that I have experienced and learned over the years working with different countries, and from there moving on to build their capacity to do it more effectively. Yeah, so that's, I think, what drove me. I was not interested only in seeing physical development, but also social, spiritual, psychological transformation in people.
Yes, like the holistic transformation,
Yes,
like you said.
exactly.
That
Exactly.
is wonderful, sir. Wonderful. So, you told a little bit about CHE strategy, or may I call it SHE strategy.
Yes.
So, can we know something more about it?
Okay, so when we got started, I would say Medical Ambassadors has been around now for this year. We'll celebrate our 43rd year of existence. And when we got started, we went through like 5 stages. The first stage, what really got us started was providing services. So we would have people who would volunteer to go from here to places where there wasn't healthcare facilities and so on. And so doctors and nurses would pack up and go there and do camps to help people with their struggles. So that's how we got started. So that was the stage of provision. But as we
Yeah.
continued to do that 7, 8 years down the road, what we started analyzing the people that we were engaging with, and we found that sometimes we were treating the same person for the same condition over
Mm.
and over again. They would get well and then we'd come back again and they would be sick. And the reason was they still continued to be in the environments that were causing their disease. So we decided that a transition was necessary in the organization to allow people, local doctors and nurses, to take over. So we built their capacity, and then we brought in the focus on prevention. So start preventing disease by having clean water, encouraging people to get vaccinated, keeping clean environments, eating healthy, proper, nutritious food, and so on. And so essentially, a lot of it was health practices. And then we
Yeah.
saw a tremendous change because of that. So the first stage was provision, the second stage was prevention. And then with prevention, we saw improvement. But then the mothers were telling us, now my child doesn't get sick, but tell me how to stay alive. My husband has deserted me and I have no source of revenue. So we
Mm.
went through the third stage, which is integration of other things. That's really when we became an integrated community development organization. So we started chicken rearing, rabbit rearing, mushroom cultivation, agriculture, animal husbandry, a range of things that were not, as far as we were concerned, essentially only medical. So, really speaking, when you look at it, anything can become a medical issue, because if you're not eating well, it becomes it results in breakdown in your body.
Yeah.
So we started integrating all of this. That is when it became community health education. So the organization that was focused only on sending doctors now became more focused on prevention, but not only prevention, but integration. So we became an integrated, holistic community development organization. So we didn't go with a package saying this is what you have to do. We went with a
Yeah.
complete open slate. We sat with them, asked them, what are your struggles? What is it you're trying to do? And we will help you to do it. So we became like catalysts to
Yeah.
bring that change. So that's how the CHE program evolved. And every
Yeah.
time we found out something new in some place, we added that. It's a curriculum-based program, so we added that. And right now we have between 8 and 10,000 lesson plans. So a lesson plan is about 2 pages, and it covers a specific issue: how to do it, what is the way to approach it, how to implement it, and so on. So typically, even though we have such a big portfolio of possibilities. In any village, you need about 10, 14 different things that you might want to do. Specific agriculture, you might want to do ways of soil conservation, you might want to do interventions for health, and or for specific things to do with the children. We have a program called 1,000 days. So from conception to completion of 2 years, what are the things that need to be done so children are healthy and survive? We have a women's cycle program, women's cycle of life program that starts with from menstruation to menopause. So the cycles that women go through and linking it. So in rural areas in the developing world, people don't know some of these things. In advanced countries, this is part of the education system and everyone learns about. So that's what Che program is all about.
That is wonderful. Like, it's very inspirational how it evolved over time.
Yes.
So I'm interested to know, what is your connection with the Global Chain Network?
Okay, we have a very interesting connection with the Global Chain Network. So I was telling you about the 5 stages. So we started with provision, transition to prevention, then transition to integration, and then we went into what was called the consolidation phase. So in 2008, there was a global recession and the economic downturn took place. And at that point of time, many of those who were supporting us were from, the sector where they made a lot of money in information technology. And when that bubble burst, a lot of our donors were affected and some of them even wiped out. So we've experienced a tremendous drop in our revenue. And it almost came down to, hey, we might have to close down shop. So a group of leaders got together and they decided, suppose this happens, let's take all of our master trainers, the big international trainers, and set them up so that they can continue the work and continue to do the training. And so we established something called Global Chain Network. And they were then to launch out. And as soon as they launched out and got going, we found this anonymous donor came to us and said, I want to support your work and so that you can continue. And that person has continued to give us an anonymous gift so that we were again able to restore. And as I reflect back, I see that if as an organization, we could have grown to 2 or 3 times our capacity. But because we released a team of people to go out and independently expand and partner with others, they are now partnering with 800 organizations. So it has grown exponentially. And they are in 130 countries, whereas we are only in 75 countries. So we gave birth to Global Chain Network, and it is doing tremendous. We have very good relationships with them. I serve on the board of the Chain Network, which is, we call it Alliance for Transformational Mission. And I'm on the board of that. So we're really blessed with that opportunity to expand.
Yeah, that is wonderful. So I would like to know the core principles of MAI.
That's interesting. The core principles we determined as we were going around, sitting with the communities and working with them, having this, what I call the dialectic process. It's in dialogue as we work together. Come, let's reason together. Let's see how we can work this out. I'll help you understand what your problems are, but also help you to recognize what resources you have. And then as we started doing this, we pooled together our team leaders from around the world, and we came together. What are some of the things that help sustain this program? And we identified 4 key things. Ownership, a sense of ownership. They must sense that this is something that belongs to them. They have ownership for it. The second thing is the focus should be on empowerment of the community. That we should at no stage create a dependence that this is our program that they are implementing. No, it's their program that we are implementing. And this is the biggest change. Second is the empowerment. So ownership, empowerment. If there's ownership, people help protect and continue that which they help to create. So ownership is important. Empowerment, once they're empowered, you see them do creative stuff between one meeting and the next stuff that they're doing on their own, because it's tremendously enhancing. The third principle is interdependence. As human beings, we are not created to be independent. We can't just be, self-sufficient little blobs. We have to
Yes.
be
Yeah.
interdependent on each other. So the more socio-economic interaction we have with each other, the more we become like a community. So interdependence. So when there is interdependence, if something can be done within the community, then you link that person, build the capacity. For example, in India, like say, for example, you have the traditional dai, or the lady who comes and helps, deliveries. So
Yeah.
what we would do is identify them, build their capacity, because, cutting the umbilical cord, it's got to be done in a hygienic way. Teach them that.
Yeah.
Explain
Yeah.
to them some of the principles. Many of them had just inherited that practice from their mothers and grandmothers.
Yeah.
So it build the capacity of other service providers who can do that. So there's a sense of interdependence. So ownership, empowerment, dependence. And then the fourth thing is sustainability.
Yeah.
If when we work in communities, as long as you keep it as low cost as possible, it can be sustained by the community. Try as much as possible not to bring things from outside till you have used to the fullest what is available. Gandhiji
Yeah.
used to call that labor intensive development. So that's what we do. Build up
Mhm.
their capacity so it's low cost, its resources are available in their community. It's not dependent on outside resources or technical support from outside. When we need technical services, then we try to build that capacity within. So sustainability. So just to summarize that: ownership, empowerment, interdependence, and sustainability. What makes MAI
Yeah.
successful, CHE successful.
Yeah. The strongest principles, I would like to call them. So, since you already told us about the woman cycle program, and you already do education, like you educate the people, you provide the medical services. So, along with these, what are some other major services that MAI provides?
Okay, so it's like if you take a stool with multiple legs and turn it upside down, the flat surface on which you sit
Mm. Yeah.
is CHE. That's the integrated community development is the foundation. But there
Mm.
are times when you need to specialize. So women's cycle of life is one of the specializations.
Mm.
Working with children, CHE with children is another specialization. The 1,000 days program is a specialization. And then we
Mm.
had this success with the women's cycle of life and other programs that the men came and said, hey, what about us? Don't we matter?
Yeah.
So we decided to do a program called Men Matter. That's the name of the program.
Okay.
How do
Yeah.
you be a good father, a good
Mm.
son, a good husband?
Yeah.
Those things. And that has been tremendously beneficial in those communities. But as we went on in the work, we
Mm.
decided that as a need presents itself, we will adapt to that. So especially
Yeah.
during COVID-19, many of the people could not leave their homes and go out. So they were just told, the village chief was told, don't let anybody go out because COVID will spread.
Yeah.
And these were daily wage earners. So they got into
Mm.
debt. And the risk with getting into debt is then you get into the hands of the loan sharks. money lenders, and then you become vulnerable because they want to try and write off your loan by, trafficking your daughter or your spouse, and so those kind of things were happening. So we started doing work on prevention of trafficking. We also started a program for relief response. So if there's a disaster that happens in a place, we are not a relief organization, but if we had a disaster in a place where we are working, then we would respond to that. So we added that as one of our programs to our portfolio.
Yeah.
So it's a wide range of services. We essentially follow what is called ABCD, asset-based community development. So whatever it is that can be done for healing lives and transforming communities using existing resources is what we do in ABCD, asset-based community development.
Wonderful. So, since you mentioned human trafficking, what are MAI's anti-human trafficking efforts? I'd like to know.
So we focus in places where there are vulnerable communities in the places which we work, and then we respond. So we have an international coordinator who works on that. Her name is Dr. Bibiana. So she is very sensitive to understand exactly where it is happening. And sometimes it needs rescuing, so we do that. We are careful not to mention where it is happening because then the traffickers will try and get back. So moving such people into safe houses. But more than anything, how do we prevent it? So making people aware. Sometimes it's your uncle, it might be an aunt who's the one who becomes the agent to do that. We've seen that happen so many times. So an awareness on that. And then linked to that is the prevention of child abuse. What are the things that children should know, in terms of a good touch and a bad touch? What they should know and become aware of. So that's a lot of that would, as much as possible, through education and awareness. But there are times for intervention. We find that someone will come when they trust you. They'll come and tell you, this is what is happening. And then there's a need for intervention. So we are connected with UN agencies, other lead organizations that prevent trafficking. And through their connections, we are able to intervene in such cases.
Yeah. Wonderful efforts. I should really appreciate this. So in what all countries are you spreaded? What all countries do you work at?
Okay, so we currently work in 75 countries. It's a long list, so I won't trouble you with that. But we are in 40 of those countries with our own teams. And several years ago, we realized that we don't need to do everything that needs to be done. So we work with partners in 35 countries. So 40 countries where we are present ourselves, 35 countries, we work with partners. So altogether, 75 countries. We have several regions. So there's the East Asia region, East Asia and the Pacific Rim, all the way down to Indonesia. The Southeast Asia region, so that's the Mekong region, Cambodia, Laos, and all that area. We used to live there, so it's an area we're very familiar with. And then, of course, where I am from, South Asia. So we work in South Asia. And then East Africa, Central Africa, West Africa, Southern Africa, Central America, and the Caribbean. So we are right now doing a capital campaign. The capital campaign is to help us to expand. So we want to go all the way up to Northeast Asia. We want to grow in the Middle East and North Africa region. And we also want to work in the lower Caribbean. That means all the way down to Guyana. Now, the interesting thing for us as Indians is that maybe 2-3 centuries ago, lots of indentured labor went from India to many of these Caribbean islands. So you'd be surprised. You go there and they speak Hindi. It's an old kind of Hindi. A lot of people from, East India So
Yeah.
Bihar, Bengal, Orissa, that region. They've been there for centuries. They still speak their language, but they've also adapted other languages. And so that's an area we want to grow. And as an Indian, I think my heart is to reach out to people like that who are marginalized from places which are from my country. So I look forward to making a change there.
Yeah. I really hope you keep expanding this more and more in all most of the countries. I really hope you cover the whole world in this.
Thank you.
Yeah.
Thank you. You're kind.
So, what are some of your strategies that you're implementing to get fundraising and also volunteering opportunities?
Okay, let me start with the volunteering. So,
Yeah.
we
Yes.
have several volunteers here locally, and I found one way to get people connected with us is have a rotational volunteering opportunity. We have certain
Mm.
functions that are done in the office that volunteers can come in. So, like filling the envelopes when we send them out to people. Uh, we do that once a month for all of the donors and prospects. So they come in and then we inspire them by telling them some of the stories. And then we
Yeah.
ask them to be, hey, this is what we do. These are some of our challenges. Keep us in your prayers. And once people
Yeah.
do that, then they want to know, how can I help? Hey, thank you for
Yeah.
asking. You can become a donor. Start with a small amount, and then as you're able to give more. So that's one process. So there's volunteers here in the US. But in
Mm.
the field, each one of these 2,674 communities in which we work has at least 20 volunteers. 10 of them are the leaders and 10 are the trainers. So these are people who volunteer 1, 2, 3 hours a day. And if you put it all together, it must be about 2 or 3 days in a week, in a month that they give for us. But if you're talking 20, at least 20 from each community, it comes to a huge number. I checked that out. It is 52,442 volunteers around the world.
Wow.
So these people belong to the community, they live in the community, they know the language, they know the culture, and they are serving their own people. And what an
Yeah.
empowerment that is, what ownership that is, what
True.
sustainability that is. So that's with volunteers. Fundraising, we have direct fundraising. So we write to those we are connected with. We share with them what is happening, and people can go onto our website and fill their names in so that they can get a. For international people, they can get it as an email of what's happening and how they can be connected. We also follow word of mouth. So those that have heard and are connected with us tell their friends, and that's how we get a lot of people. I also speak at various events and then share with them, and I find it so inspiring sometimes when they hear stories. They come, some people will be tears in their eyes. I want to help someone just like that, and I want to my life will be of value if I can do that. And then, of
Yeah.
course, those that are already connected with us, we continue to engage with them on a frequent basis. And we are trying to use social media as much as possible. We're just launching an effort to even include using things like TikTok and stuff. So we found some younger people who could help us in doing that. So those are some of the fundraising strategies. And right now we're doing a capital campaign that is aimed at helping us grow the organization and make it stronger, build the next generation of staff to take leadership. So that's what we're doing. And, COVID has taught us that we need to use virtual technology. So we're exploring things like artificial intelligence and use of a lot of virtual techniques for training. So
Yeah.
building capacity for that, that's what we are raising funds for.
Yeah. So, with all the good work, there must definitely be a lot of challenges that must be coming your way. So, what are some of the challenges that you had to face?
Challenges come in different forms. Sometimes disasters that affect, we had major flooding in some countries.
Yeah.
That's one. Sometimes marginalized places are places where there is a lot of tribal conflict and
Mm.
disturbance. So that seems to happen a lot in many of the places. Nigeria is a place there's a lot of conflict. DR Congo is a place a lot of conflict. Then there are disaster-prone areas with disease. So those are some of the challenges they face. But as an organization, funding is always a constant challenge. So um, we don't want to just sustain ourselves. We want to be able to grow. So funding, I would say, is one of the constraints. But, somehow or the other, at the end of the day, that funding seems to come in. And we are really grateful for each one of those that pitches in to help us run the organization.
Yeah. So, what is your most notable accomplishment so far, and what has that made you feel?
One is I took over in 2017. So my self-set goal was let me make the organization more and more sustainable. So I think that has been the biggest encouragement to see it moving towards sustainability, to see it growing and adding new communities. So in the last 5 years, we've added almost 200,000 people to become beneficiaries of our program. And we've tried hard. There are two ways. One is you raise more money, and number two, you also try to be as efficient as possible. So that you get the maximum out of every dollar that you spend. So we've been trying to be that. And we've been sort of acknowledged top 10 in the world for high efficiency. And we also set up a academy called MAI Academy that has courses that people can take. And we're trying to make that as much online as possible so that people don't have to be up at some odd time in the night to be able to connect with everyone. So they could just do the course whenever they have time and then get their
Yeah.
own, so build their capacity. We added a
Yeah.
relief wing, and so this has been a really good achievement. We've been very satisfied with that. And of course, with the prevention of trafficking, it takes a
Yeah.
lot of effort to just save one child. But you remember that story about the man who was throwing back the starfish? He
Hmm.
was throwing back, and a guy was jogging, and he said, "Hey, what are you doing?" And he said,
Yeah.
"I'm throwing the starfish back into the sea because once they got onto the beach, they're not able to survive. They dry up." So he
Hmm.
watched him for some time, and he looked at both sides of the ocean, and he said, "This is such a long beach line. What difference are you going to make? So many thousands get thrown onto the, the beach." The
Yeah.
man did not hesitate. He picked up one of the starfish and he threw it back, and he said, "It made a difference to this one."
Yeah.
And I think that is what we do: make a difference to those, especially the individuals. We make a difference to the families. We make a difference to the community. Now,
Yeah.
2,674 communities is not much as compared to the whole world, but we're
Yeah.
doing that which we are able to do, and we're trying to do it
Exactly.
as best as we can. So we think we owe that to our creator.
Mm.
He made us and he placed us here, not for ourselves, but to serve others. So we try to do that. And that's what is holistic about us
Yeah.
and in the way we serve.
Yeah. Wonderful. So, with that, we are done with the last question of our interview. It's been really amazing interview, and I could like literally see the positivity in your tone. You're very calm and soothing, and the whole thing is actually reflecting in your organization. So, yeah, this information has been like very insightful and very, very inspirational, I should say. And yeah, we hope you keep the good work up and expanding it more and more of your centers across the world. And I also hope more of TAL Radio listeners come front and take volunteering or make donations of whatever help that they can provide you. I really hope that happens.
Thank you, Saankhya, for your kind words. We encourage the TAL Radio listeners to go to our website. It's www.medicalambassadors.org. And if you have any questions, write to us and we'll respond to you. Thank you so much for giving us this opportunity to be interviewed on TAL Radio. We hope many of your listeners will seek to volunteer for us and connect with us and make a difference. Remember, don't let the fact that you cannot do everything stop you from doing something.
Exactly.
And each of us can make a difference.
Yeah, we have some wonderful listeners, so I'm pretty sure they must be coming forward. So yeah, let's hope for the good. And I wish you all the best with everything that you're doing.
Thank you so much.
Thank you. Thank you so much for taking time and being here. So that was Dr. Ravi Jayakaran. And I hope that you find this interview very well and insightful. For more such interviews, stay tuned to TAL Radio. And this is me, RJ Saankhya, signing off for today. Take care, you all.